An adaptation to heat waves, again a SANDEE sponsored study, thanks to Priya. Now here I am just trying to say whether some of the strategies that the government has adopted in India, in one of the state government of India, is working or not, reducing heat wave deaths. Now, I think this is a general definition of heat waves. It says that under normal conditions, the body's internal thermostat produces perspiration that cools the body, and if you have a spell of hot weather where you have a high temperature and high humidity, then this doesn't work, and your body has to work extra hard to cool down, and if your core body temperature goes more than 40 degrees centigrade, then that causes something called the hyperthermia, that is the collapse of the body and the person dies. So that means for the heat waves to have a very fatal effect, then you have to have a high temperature and also high humidity. Now, but in India, that's a slightly different definition of heat waves. They define it on on the absolute temperature, and for different areas, if the temperature of area is normal temperature is less than 40 degree, then you can have a heat wave it goes more than 5 degree, and a severe heat wave it goes more than 7 degree, and if the normal temperature is more than 40 degrees centigrade, then the margins are slightly different. And similarly, if you irrespective of the normal temperature, if you have 45 degree temperature for 2 days, then you can have a heat wave. So we measure heat waves by number of days, 1 day, 2 days, 3 days, like that. So slightly different than how you say, and they don't take humidity into account. Basically, based on the temperature, they define all the heat waves. And in my analysis, I have used this particular definition of heat wave. Now, this is a global phenomenon, in the sense like in many parts of the world, heat waves are being experienced, and mostly in the developed countries. So you have this experience where you have Chicago 95, 99, Mexico, and I think the most important one, recent one, was the 2003 heat waves in Europe, where like I think around 27,000 people passed away. And in India, we have these two states, one is Orissa and Andhra Pradesh. These are the two coastal states, Bay of Bengal coast. And there also we have this problem since few years. And coming to the studies and responses, we also have some of the responses to tackle heat waves, but there are very few. One, like we have this study effect, that's a California study, and this is one of the big projects that happened in European Commission. And then you also have, and what they say, you should go for heat wave warning, activation of the social network, health education and awareness. So these are some of the responses to tackle heat waves. But so far, there is no evaluation of the health education or awareness programs. I think my study is one of the first where we are trying to see whether the awareness program is helping or not. Now going to the literature, we basically have one is that temperature and death, they are related. So there are many studies that says high temperature leads to high death. But coming to heat waves and death, there are very few studies. Basically I put them into 3 different categories. Now some studies have analyzed individual events, and they say socio-economic factors also play a role. Poor people die more. If you don't have air conditioning and if you are exposed every day, then the heat waves will have a higher impact on you. And there are also some other studies that compare different cases, and they also give more or less the same conclusion that socio-economic factors do have a role. And there is only I think one study on the impact evaluation of the state response, and that also says that if the government is giving you heat wave alerts, that help people to adjust to the heat waves. This is the study, and most of these studies are in USA. Like we don't have any study on developing countries at all. Now, so I did my work on this state, again the state of Orissa. It's very poor state, one of the poorest in India. And if you see these statistics, 30 districts, 10 agroclimatic zone, and per capita income is $220 per annum. And 47% of the people are below poverty line. So this is one of the most poor, and then is agriculture, 75% of the population work in agriculture. So one of the poorest. And what happened in this state, this is a coastal state, I am from that area. So we never knew there is something called heat wave which is existing in the world. Suddenly in 98, people moving on the road and they just collapsed and died. So it was something very alarming. 2,000 people, and before that, that we used to be some heat waves in some western part of the state, and very few deaths, but suddenly in that year, more than 2,000 people passed away. And so state government and even the general public, they are all really taken aback. What's happening? And I think by then also the climate change was not a talk in that part of the world. So this is what's happening. Like they just take, okay, the God is become angry on us, that people are dying on the road. Okay. So after that, the state government also, started taking some action, started giving some warning, and they had a calamity committee, and the calamity committee used to meet and give some, okay, let's take some adaptive actions. And as you can see here, after 1998, the number of heat wave days has remained at a very high level, and also number of deaths has remained high. Now, when I plot them in a graph, you can see here, so till 2005, so number of heat wave days and number of deaths are more or less following the same pattern. But after 2006, there is a change. So this is increasing at increasing rate, heat wave days, but deaths are increasing at a diminishing rate. So I thought probably there are some interventions in 2002 onwards. So I thought probably those interventions have something to play a role. So I just tried to find out what is the impact of those interventions. Now this is, and as you can see, and like just coming to see whether temperature increase is a reality or not. You see, this is the temperature measures for 30 years from one single station, that's the Bhubaneswar, that's the state capital, and as you can see here, the normal temperature is really going up in that state. The normal temperature is 38 degrees. So if you have temperature more than 39, then that is heat wave, and as you can see here, the number of heat wave days are really going up over the years. So the warning is a reality over there. And then coming to the intervention of the state government, these were the interventions before 2002. So what they have a calamity committee, they used to meet either in February or in early March, and these were the interventions, heat wave warning in the radio, and then there is something called Jal Chhatra. Jal Chhatra is a free distribution of water. So at every marketplace or bus stations, you give freely distribute water, so that people have water if it is very hot. And then then they used to have some more facilities in the health centers, and rescheduling of the work hours, school timing, etc., etc. And there was some discussion on the television. What is the heat wave? What you should be doing, and all that. So very simple activities. Then what happened in 2002? So this UNDP program started, and that's called the Disaster Risk Management Program. Now this program was something very innovative in the sense. We had in Orissa 98 we had the heat waves, and 99 we had a super cyclone that I was talking about yesterday, mangroves and super cyclone. In 2001 we had a severe earthquake in India, state of Gujarat. Lakhs of people passed away, and we also have a very severe flood in 2002 in the state of Bihar. So flood, earthquake, and this one flood, earthquake, and the third disaster was three disasters: flood, earthquake, and cyclone. So these three disasters caused this DRM program. So because Orissa is a very vulnerable state, it has 30 districts. So in 16 districts, this DRM program was initiated. So this is the initiative of the Government of India, UNDP, and state government. And then Orissa government also formed a disaster management cell called WESDOMA, Orissa State Disaster Management cell. That's WESDOMA. And WESDOMA was the nodal agency for implementing this DRM program. Now what happened in DRM? So that disaster management strategy changed. Earlier it used to basically relief and rehabilitation, then they shifted over to planning and preparedness. So the government says now we are away from 3R to 3P. Okay, relief, rehabilitation, and to planning, preparedness, and precaution. So in the planning process, what they do, they give a lot of awareness to the public. They tell them what is a disaster, what is the nature of the disaster, what precautions should be taken, what is the first aid, what are the symptoms of this disaster. So they usually do that. And though DRM, basically in Orissa we don't have a lot of earthquake, so mainly flood and cyclone. So as you can see here, all the coastal districts were covered under the DRM program. So because these are all cyclone prone, and so also these districts which are highly flood prone. So we don't have heat waves is occurring all over the district. So for heat waves, almost the district selection was more or less random. There is no selection bias. I also tried to find out whether the occurrence of other disasters and occurrence of heat waves have any correlation, but we didn't find any high correlation between the other disasters and heat waves. So we think that the district selection for heat waves was more or less random. Then after this program what happens, these things were added to the heat waves management, that is awareness generation through multiple media and awareness activities through government organizations and non-government organizations. So the awareness was a component of the heat wave management after the DRM. So DRM started in two phases, 2002 to 2007 and 2003 onwards. So I think from 2003 onwards the treatment, the intervention started. Okay, then the extra intervention was awareness, and whatever was happening before all these different activities, so they are all continued. So they were there from 99 onwards. So they continued as usual, but the extra was the awareness. So what they do? They have posters, very catchy posters. They put it everywhere, and they have they print. They see that okay, almost every village should get a poster. What is a heat wave? And they put it everywhere at the critical points so that people are aware heat waves. And here you can see these are all in the local languages. So these are the things that you should be doing, and they call Ansughat is the name of the heat wave in local language. And these are the activities you should not be doing. You should be having an umbrella. You should be wearing glasses, so that you don't. And then you should be having a lot of liquid food. And so you should not take alcohol. If somebody is feeling unwell, you should immediately take him to the hospital. So similarly also here they try to do this. Now two different organizations are doing this. One is Westoma, the disaster management department, and the other one is the State Health Institute. So Health Institute does all the research. What are the steps to be taken so that you avoid the health impact. And both of these institutes, they try to publish newspaper advertisements and give all these advertisements in the radio or different television channels, etc. So a lot of activities are going on since then. And if you talk to some public also, and if you go to any of the cities during summer months, then you see everybody will be covering their head. So we have some cotton clothes, and they all wear cotton clothes. So see visible, the impact is visible, that people are really aware, and there is some behavioral change. Now, these are the detailed program input. This is what the government says you should do this, and if you study this in detail, they do not involve any cost. So only thing is that you should change your behavior. Okay, so no cost here. Public, because they are poor people, so they really can't afford it. Only thing they say that okay, don't go out in the empty stomach. You drink a lot of water, eat water rice. That has been a habit in that state. Since the very beginning, that people in the early morning they eat water rice for breakfast. So eat water rice, and all these things in detail. Cotton clothes, etc., etc. So no cost, only change your behavior. And then we expect that if these things are really having some impact, then these are the possible program output, and these are the possible program impact. So now because I didn't have data on the heat attack and hospitalization, so I had some data on the mortalities. So I tried to evaluate this particular DRA program in terms of mortality reduction. So then these are the two objectives I tried to find out: does intensive dissemination, and now what's happening in DRM. So we have 30 districts, 16 in DRM, 14 in non-DRM. So now the dissemination of this awareness is through the public media. So even the DRM and the non-DRM are getting the same information. But the difference is that in DRM we have the representative volunteers in every village. So that is intensive dissemination of the awareness activities. So everybody, that is somebody who is going to house and telling them you should do this, you should you should not do that. But in the non-DRM, you do not have this intensification. Whether people listen to you or not, that's all up to them. So that is intensive dissemination of activities in the DRM. So I try to see whether that is helping, and secondly, whether the awareness, this grassroots program in the form of having village volunteers is having any complementarity with the awareness campaign that is going through the media. So if you see the death, so you can see here these are the they are following more or less the same pattern. So here there is a change. These are the non-DRM death, and these are the DRM death. Okay. Now what I did here, I followed some technique called the DID, difference in difference technique. So where you try to take a control group, a treatment group, and then see the difference between the two. And for the second objective, to find the complementarity between the intensive DRM program and the media program, I followed something called the triple difference methodology, difference in difference in difference, and I used a panel data for all the 30 districts for 13 years. So, I have years before DRM, years after DRM, districts with DRM and districts without DRM. So, now just I am trying to explain you what is a DID. In a very simple setup, when you have take 2 period and 2 groups, suppose one is before the program, one is after the program, and one group receiving treatment and one group not receiving treatment, which is called the control group, and you see the death before the program, after the program, similarly here also, and you take this difference. So, this is the difference of the treatment group, this is the difference of the control group, and the difference of these two is called the DID. So, this is called difference in difference. Okay? And if you take simple this one, without taking into account the baseline, then you do not get a correct picture, because you see after the treatment even the DRM districts are having more death than the non-DRM. So, in this case you will not get any correct picture. So, to get a correct measure of the treatment, you have to have a 2 group, before the treatment, after the treatment, also this one. And similarly here I just try to explain it in a diagrammatic sense. Suppose you have a number of years, then this is where this is the DRM and this is non-DRM, and after the program you are getting this thing, but still the DRM is having a higher death. So, to measure the program impact, you need something called the counterfactual. The counterfactual is what would have happened without this program, and the counterfactual you get, this is the counterfactual which you get from the control districts. So, the difference between the actual and the counterfactual is the difference in difference measure. Okay. So, now I have this final result. So, in a DID setup you would have an interaction term, and this is the interaction term that measures the program impact. So, this DRM period, district, and the interaction between these two is the program impact. As you can see here, I have 2 different estimates for that. So, here you are having a negative effect and they are all highly significant. That says this DRM program has impact, they have reduced the death. Okay. And this also has a number of other, that if you see here. So, one is the forest cover is also responsible for reduced death, that is another adaptation thing. And then if you see the per capita income and district net domestic product, this is coming out significant to the positive side. So, that is this being a poor state, when the state GDP is increasing, that is basically in the exposure based activities. So, maybe that is the reason why with the districts with the higher district domestic product are experiencing more death. And this is also being supported by this one, when you have population share other workers. So, other workers are the ones who are working in the service sector mostly, and they are also more exposed, as you can see here. So, that is also positive with a significant coefficient. So, that means like in future when you have more of this, because in a poor country when the income goes up, so exposure based activities increases, and that also causes more death. And then I try to get the second one, the complementarity between DRM and the awareness program. So, for that I estimated different models. I am just giving you the coefficient that measures that impact. So, you can see here these are also again negative and significant. That says there is some complementarity between the DRM program and the awareness media. Okay. And I try to measure the program impact, the death averted, that comes around 155. But recently the government of Orissa also has revised some of the estimates. When I use the new estimates, then this program impact comes to 170 deaths averted. It is a very, very high number. So, because of this program, these many people their life was saved. And here I try to do some cost benefit, how much was the DRM cost and how much was the benefit we are getting from the DRM. And as you see here, the heat waves was not a component of the DRM. So, only because the money was given for other disasters, but the heat waves being a regular killer, the government allocated some money to heat waves. So, this was the total budget allocation of DRM for 125 districts of the country. Orissa share was only $3.4 million, that comes around 165 million in Indian currency. The state government covered 8 disasters. So, that means for heat wave this was the budget. And so, we averted 155 deaths. So, this is the cost per life saved. And if you take the VSL for Orissa, then that comes to 14.17 million. That means the benefit is 118 times higher than the cost you are putting for the saving a life in that state. So this is a big number. Okay. Yeah, just finish last one. Okay, so now and if you take the other measures, so then your benefit is much higher. Okay, so now just conclude here that probably spreading awareness on how to reduce your exposure and take some very simple precautions so that your exposure to heat is reduced is having some result, and this is strategy disseminated intensively in DRM district of Orissa has reduced these many deaths. Media use and grassroots program seems to have complemented each other. But only thing is that when I do a linear, these are all non-linear models I have estimated. When I do a linear model, then I do not get this effect. So that means these results are not robust to the model specification. For my data, this I have I have used some Poisson and the other non-linear models, but for linear I do not get this effect. They do not become significant. So now I am trying to re-examine this issue with a bigger data set. So that work is still ongoing. So I have collected some 30,000 observations and trying to see this in more clearly and more closely with the different age breakup and etc. But I think still this is a very promising result, saying that okay, these adaptations are helping.